till I get that, till I get that, get that.
Hi, my name is Dr. Sameer Gupta and I'm an interventional cardiologist. Now, you've all heard about cholesterol and how cholesterol can be harmful to you. It increases the risk of heart disease, it increases the risk of stroke, it has multitudes of side effects and problems that it can cause. Now, the best way to reduce your cholesterol is to do diet and exercise. And what I mean by diet and exercise is exercising regularly, the American Heart Association recommends that you should do about 30 minutes of vigorous exercise 3 times a week, or you do 30 minutes of moderate level exercise like walking in a park or doing some other something that gets your heart rate up and something that makes you feel that you've done some exercise for 30 minutes 5 days a week. So that is exercise. And the second thing that can help lower your cholesterol is diet, making smart choices when you eat, reducing the intake of saturated fat, having a diet which is rich in fruits, green leafy vegetables, beans, etc. It really helps getting your cholesterol lower. But diet and exercise may not be sufficient for some people, or it may be impractical for some people. I hope it's not impractical. I hope you're all able to make adequate changes in the diet and lifestyle. But some people may not be able to get the cholesterol low enough where it reduces the risk or where it negates the risk of having heart disease. So some of you may require other medicines to reduce your cholesterol. Now, there are a multitude of medicines that we have to reduce cholesterol, and the most common one is statins. I'm sure you've all heard of medicines called statins, called rosuvastatin, it's called atorvastatin, it's called simvastatin. Multitude of different drugs come under that umbrella. And statins are actually very good drugs, and they've been around for a long time, and they help lower your cholesterol. We found that they reduce your risk of having heart disease, they reduce your risk of having stroke. Sometimes I'm an endovascular interventionist also, so that means I deal with peripheral vascular disease, blockages in the arteries of your leg, and they even help reduce the risk of having blockages in other arteries like your legs. So statins are an important drug, and if your doctor may recommend statin drugs, he may want to check your liver enzymes every now and then. And I know there are a whole host of side effects that you've all read about on TV and read in the news, but at the end of the day, statins are still very good drugs. They reduce your risk of having heart attacks, they reduce your risk of having strokes, and a lot of other medical problems. But diet and lifestyle is absolutely essential, and along with that, statins or other drugs for that matter may be required.